Kevin was 59, private, determined, quite strength, but even stairs defeated him. One flight left him winded, not fear, something deeper. Doctors ran tests on Kevin. Heart rhythm looked mostly normal. Valve wasn't working with ease, but it wasn't urgent yet, so they watched and waited. Meanwhile, Kevin kept slowing down. His chest felt tight. His energy disappeared quietly, like something inside him stalled. Then something invisible shifted. His calcium rhythm returned, and his heart came back online. Something inside him lost rhythm. It wasn't just feelings, it wasn't simple tiredness. A quiet signal had stopped, but his body already knew. I'm Dr. Server, MD, Ph.D. in Molecular Biochemistry and Genetics. What you will learn today: first, your heart needs flow, not just muscle, not pressure. Second, energy drains from inside even before symptoms feel serious. Third, repairing flow rebuilds strength. Without pushing, without pills, each beat starts with calcium. It enters and says contract, then exits and lets go. This happens every heartbeat, quiet, constant, without delay. But when exit is blocked, your heart starts to resist. It fights its own beat. The muscle can't relax easily. That pressure turns into fatigue. Over time, it forgets how to breathe between beats. Ever felt this kind of tired, not sleepy, just worn down? You feel drained without reason. Breathing feels shallow or tense. Your chest feels tight, unsettled. It's not in your head, it's calcium clogging your cells, especially where energy is made. You have tried eating better. You have added movement, tried supplements, but pressure still doesn't shift. Why? The vessels don't soften. They stay tense from misfired flow. Your heart may still pump, but it doesn't feel light. It's not emotion, it's internal traffic inside cells. How breakdown happens? Your heart is a symphony. Calcium keeps the rhythm steady. But if flow speeds up or pauses at the wrong time, the whole system gets offbeat. Inside mitochondria, energy drops. In vessels, flexibility disappears. In pacemakers, timing goes uneven. You may feel okay sitting, but one flight takes everything. You may look healthy, but feel like power is gone. A small change can help. Morning sunlight and short walks. When soft rays hit skin, they release stored nitric oxide, a gas that tells vessels, relax now, loosen gently. Even without changing vitamin D, gently UVA lowers blood pressure in clinical trials within minutes. Best timing: before 10 a.m. or after 4 p.m. Direct light on lower legs or forearms. 10 minutes daily. Stop before skin turns pink. Fair skin? Use shorter time. Darker tone? Stay slightly longer, but still avoid burning. Use sunscreen on the face. It ages faster under light. After breakfast, walk 3 minutes. Just a slow, calm stroll. Moving muscle clears sugar gently, keeps pressure off the vessels. Even micro walks stabilize glucose more than one big workout. Calmer sugar equals calmer arteries. Less inflammation, less plaque growth. This combo works silently. Sunlight plus motion equals flexible vessels. Easy, free, and deeply effective. 3 bigger truths. First, heart trouble starts early. Before weakness, there is restriction. Second, calcium doesn't disappear. When it leaves the bone, it finds new places to settle, like your artery walls. That's why brittle bones and hardened arteries often go together. Third, too much calcium inside cells is more damaging than outside loss. It blocks energy. It triggers silent inflammation. It makes tissues hard and tired. Back to Kevin's story, he didn't push harder. He didn't chase more meds. He gave his body rhythm with AIC therapy, anti-orbital ionic calcium. This therapy untangled the traffic guided calcium back to balance and reactivated his own hormone that restores natural calcium rhythm. The result? His energy came back, his chest felt open again. He walked without needing to stop. No extreme effort, no surgery, just smart inner balance. If you feel tired, even doing everyday things, if your chest feels heavy but no one sees it, it's not always in arteries. It's what gets trapped in cells. When calcium flow is disrupted, your recovery can slow down. But when rhythm returns, your strength begins to rebuild, not by force, not by guessing, by listening to what's underneath. If this information helped you feel seen and gave your symptoms a voice, tap subscribe to stay connected. For more tools that respect your body and more stories like Kevin's, share this with someone who is ready to feel like themselves again.